after having had the procedure and then returning to the ward, depending upon the access site, so if it's in the wrist, the patient will be able to sit up a little bit earlier. If it's in the groin, the patient will be expected to lie flat for about 2 to 3 hours until the nursing staff are happy that there is no bleeding from the site of access, bearing in mind the fact that we've inserted a tube into an artery and that we've also used medication both orally before the procedure to make the blood take longer to clot, and also used heparin during the procedure. So initially the patient would be expected to lie reasonably flat and to be sort of fairly comfortable. We would ask the patient not to eat or drink for about a couple of hours or so, usually after the procedure. Maybe they can have small sips, but obviously if they're horizontal, they wouldn't really particularly want to eat anything. And usually they'll be fairly comfortable, and if they need analgesia, if they're having any slight discomfort, sometimes after stents have been inserted, because they stretch the artery, then because there are nerves in the wall of the artery, sometimes patients can have a sort of residual discomfort for an hour or two, and usually that settles down. So after about 2 to 3 hours, I would expect that the patient is, if not fully upright, then at least able to sit up, have something to eat and drink, and generally should be really very comfortable. If the procedure is performed before the middle of the afternoon, and if there are no problems in relation to bleeding from the access site, the ECG looks okay, the patient feels comfortable, then actually most patients, certainly elective patients, would be allowed to go home the same day. If the procedure for various reasons has taken place later in the day, if it's a more complicated procedure, certainly if we've had to use larger tubes to get access, if we've had to use both groins, if it's a chronic occlusion angioplasty, then as a precaution, or if, say, the patient's elderly or if they have an elderly carer, then I would generally err on the side of caution and ask the patient to remain overnight. But they will be in a hospital bed almost in a sort of pseudo hotel way, in the sense that they're not really being nursed, they're just being observed and monitored, and then all being well and good, the patient would go home the next day. In terms of their aftercare, they may feel a little bit weakened for a day or two, because it is like having a small operation internally, although the majority of patients feel fine. So I usually ask the patients to really take things fairly easily for a couple of days, especially if they've had a femoral puncture as opposed to a radial puncture. But after really 2 or 3 days, then I'm perfectly happy for the patients to start to exercise a bit more. Legally, patients are not allowed to drive for a week. Okay, that's a legal stipulation, and so therefore they have to make provision for that. If patients are of working age, I usually advise them to take the next week off, just in case there is anything ongoing, and also it gives them a chance to get their confidence back and actually sort of see how things are. And then in terms of medication, the medications that they would be have asked to be taken before the procedure, the aspirin and clopidogrel type medications, they will continue. If there are any changes to the medication following the procedure, then that will have been discussed with the patient whilst they're in hospital. If there are any problems in terms of stomach discomfort or upset, then obviously other things can be added. And then most importantly, in terms of follow-up, access to me and the services that I provide, I would expect to see patients at 3 to 4 weeks following the procedure, and as a sort of courtesy, we usually offer patients the chance to attend cardiac rehabilitation at their local hospital as well. So in my case, usually they would attend cardiac rehabilitation at Southend Hospital. There are 2 components to that. There's the physical component, which most patients find very reassuring, and then there's also the educational component, where there are lectures from dietitians and physiotherapists and so on, and patients generally find that of use. For younger people who are of working age, sometimes they find that a little bit intrusive, but at the end of the day, what works for one patient doesn't always work for somebody else. But there is this overall package of immediate aftercare, then long-term follow-up by myself medically, plus the input from the nursing staff, and that sort of holistic approach makes the patient realise that although the angioplasty has been done, aspects or modification to their lifestyle are important, and so therefore this is a lifelong process, and the vast majority of people feel significantly better for modifying their lifestyle and for doing all the right things once they've had the procedure compared to how they were beforehand.